CPAP therapy has a very high safety range. It does not cause really serious side effects that threaten the life and health of the patient. Among the unpleasant consequences of using CPAP machines can be swallowing air, nausea, reflux, that is, belching, dryness in the nose or mouth, nasal congestion. These phenomena are associated with the ingress of air into the esophagus under pressure. Swallowing air, aerophagia, and bloating is a common side effect among new CPAP users. Most of the inconveniences in the treatment of apnea with the CPAP device are transient, overcome in a short time and without much difficulty. Since not everyone can immediately get used to this therapy, and some patients experience difficulties at first, doctors may recommend small nuances in the use of the device at the beginning of therapy. For example, use CPAP for the first few days when you are very tired and do not need extra effort to fall asleep. Also, wear a mask and turn on the device when you are awake, when you watch TV or read, in order to get used to it faster. However, to get a successful result, you need a lot of perseverance. CPAP devices are becoming more and more advanced. Data from them can be directly uploaded to the cloud for further analysis. Now, when the data is collected electronically, it is immediately visible how long the patients sleep with their mask on. Doctors have found that many patients do not use it or remove it shortly after falling asleep because it is uncomfortable and interferes with sleep. Studies show that between a quarter and a half of all users stop using CPAP in the first year of therapy. However, to tell the truth, you need a lot of perseverance and patience to get a successful result. Our old friend Michael from Illinois also chose CPAP therapy. The first night he tried the machine, he had a great night's sleep, even with the mask on. This happened in the laboratory under the supervision of doctors. But the positive effect of the first night quickly dried up. At home, he could not experience the same. The fact is, the first letter C in the English abbreviation CPAP means continuous. Imagine the machine is constantly supplying air, even when you exhale. You have to fight this opposite airflow. Michael woke up gasping for breath. On top of that, I had to sleep in a mask that squeezed my face. Air seeped out from under the mask and dried out the eyes, even when they were closed. For Michael, most of his nights ended up just throwing off his mask. In the morning, he checked the statistics and saw how little he had used the device. The doctor tried to help by adjusting the air pressure and suggested trying other masks. Michael came to the laboratory several times, but it was all to no avail. Finally, the doctor said, if you lose 15 kilograms, the problem will go away by itself. Indeed, obesity significantly increases the likelihood of developing sleep apnea. In 2009, with a height of 180 centimeters, Michael weighed 95 kilograms. So, at the beginning of 2010, the man decided to lose weight, and he succeeded. By the end of the year, he reached a weight of 80 kilograms. Michael got rid of his apnea with no mask required. However, it turned out that he won the battle, but did not win the war. 10 years later, the pounds slowly returned, and with them the sleep apnea syndrome. He did not realize this until the summer of 2019, when he had to undergo an operation on his spine. As it turned out, the sleep apnea poses risks for patients during surgical operations, can affect the outcome and the likelihood of complications. Losing weight is healing, Philip Smith, professor of sleep apnea and lung disease at Johns Hopkins University School of Medicine, says. The problem is, people generally can't do it. And if we add to this that many patients cannot use CPAP therapy, then there are very few ways to get rid of sleep apnea. In the mid-1990s, for those who cannot stand the mask, they came up with a device that is inserted into the mouth and forces the lower jaw to move forward, and with it the tongue, which can block the airflow during sleep apnea. Like CPAP, this device is not a perfect solution. It keeps the jaw in an unnatural position. The person may feel uncomfortable. Prolonged use may change the dental occlusion. However, most patients are quite satisfied with the results of using this device. It is suitable for patients with moderate sleep apnea. In severe cases, CPAP therapy is preferable. Patients who cannot tolerate mouthpieces and CPAP masks can try jaw repositioning surgery, which is better than having a tube down the windpipe. Another treatment option for sleep apnea is electrical stimulation of the hypoglossal nerve, which causes the tongue to contract and stop falling back during sleep. As Lawrence Epstein, Assistant Medical Director of Sleep Disorder Services at Boston Women's Hospital and recent chair of the American Academy of Sleep Medicine, points out, CPAP therapy is still the gold standard, but in the end, treatment comes down to the most appropriate option for the patient. We have very effective methods, but each of them has its drawbacks, he says. What's good for one patient is not necessarily good for another. Doctors place their greatest hopes on pills that have not yet been created. The future is neurochemistry, Professor Smith says. Probably in 10 or 5 years, we'll be able to treat sleep apnea with medication. It's actually a neurochemical problem. Fats release certain hormones that cause the airways to close. According to experts, CPAP fights a physical problem, not its cause. The medicine also affects the brain and nerves that control the muscles of the upper respiratory tract. There are also gratifying results. One placebo-controlled international study of the effect of 2 drugs used in a specific combination found that they greatly reduced the degree of sleep apnea, removing obstructions in breathing during sleep by at least 50% in all participants. However, for people like Michael, who are suffering from sleep apnea right now, the wait may be too long. For them, all this means only one thing: a return to the diet and regular visits to a sleep specialist. Scientists believe that the sharp increase in the number of people suffering from obstructive sleep apnea is a direct consequence of the obesity epidemic. 20 years ago, in different regions of the world, no more than 2 to 4 people out of 100 faced the problem of sleep apnea and its devastating consequences for the body. Today, their number has increased by 3 to 4 times and is from 8 to 10% of the population. These catastrophic statistics are not accidental and are directly related to the real scourge of the 21st century, the obesity epidemic that has affected all economically developed countries and literally ravaged the United States and Australia. Although snoring in overweight men, accompanied by regular cessation of breathing, occurs more often, but obese women, especially those who have menopause, often have to put up with obstructive sleep apnea and its inevitable consequences. Fast food, unhealthy eating habits, and reduced physical activity are doing their dirty work. The number of overweight men, women, and even overweight children snoring at night is growing steadily and rapidly. Without timely and effective treatment of sleep apnea, they are in for a grim fate. Underachievement, low working efficiency, a bunch of chronic diseases, and often disability and early death. It would seem that the solution is simple and suggests itself: to change the way of life. This is correct, but it is not enough because, among other things, it is very difficult for people with sleep apnea to lose 30 or more kilograms. After all, inadequate night rest and constant oxygen starvation lead to a decrease in physical activity and metabolic disorders, and this, in turn, contributes to even more weight gain. As a result, the vicious circle is closed. Excess weight causes problems with breathing during sleep, and problems with breathing during sleep result in further increase in body weight. Thus, many doctors believe that the approach to address these concerns should be provided from the other side. First, get a normal sleep. Get rid of snoring and sleep apnea. Improve well-being, and only then, gradually and without stress, get rid of extra pounds. Sleep soundly, nurture life is the slogan of World Sleep Day, celebrated every year in mid-March. World Sleep Day is a recognized international event that brings together sleep medicine professionals and patients around one important common concept: sleep. Always there for you, Dr. Popmed.